If you're experiencing any of these uncomfortable symptoms of the transition to menopause, but you're a little concerned about going on antidepressants, or you don't want to do something that feels as extreme as hormone replacement therapy, we have a lot of naturopathic options that can make the transition more comfortable and more gentle as you transition into this normal state of menopause. Hi, I'm Dr. Angela McKay, chiropractor and naturopathic physician, and I'm here to talk to you on Motivational Monday about treatment for menopause. So if you are going through menopause, know that it is a perfectly natural, normal phase of life, but it can come with some rather abrupt and uncomfortable symptoms depending on your situation. So if you were to go to your primary care medical doctor, the first line of treatment for hot flashes and night sweats and the irritability and mood changes that can come along with menopause is to prescribe antidepressants. And so when your doctor does this, he or she is not doing it because they think that you're depressed or that you're crazy. What they're trying to do is to mitigate the response that your brain has to the changes in your body, where it can overreact and create hot flashes or chills or irritability or mood swings. And so these things come along because your hypothalamus, which is a part of your brain, is looking at all the things in your body and trying to generate homeostasis, but your adrenals and your ovaries are doing different things and they're putting out inconsistent hormone levels. And so the hypothalamus responds, and it is one of the major jobs of the hypothalamus is to regulate your body temperature. And so it over responds and creates a lot of heat and gives you hot flashes or night sweats. And no wonder that is creating some irritability. It's very uncomfortable. So the role of antidepressants in treating menopause is really to calm down the nervous system so that you don't get such a big reactionary swing in temperature or hormonal influx. And that is how they work. However, they come with a lot of side effects. So already with menopause, you may be having some vaginal dryness, maybe lacking some energy, and having a big dip in your sex drive. And antidepressants are well known for just absolutely killing your sex drive. So you may have less hot flashes, or you may have a better mood, but you may still be dragging and you may still have nothing in the sex department going on. In addition to all of that, antidepressants come with other side effects, and they can be very hard depending on the particular antidepressant that you would be prescribed, very hard to come off of. So you can't just quit them cold turkey without a significant withdrawal response. That could take months to a year to fully come off of those medications. So they may not be the ideal medication for you. Other things that your medical doctor may have to offer include hormone replacement therapy, and that may be a little tricky depending on your situation, especially if you've ever had breast cancer or you have a family history of breast cancer. There are some things there that you may want to steer clear of. Those also have some side effects as well, and it's not a one-size-fits-all perspective, but usually the prescriptions, and there are many different prescriptions for hormone replacement therapy that are available through your regular medical doctor. Some can be really beneficial, and some can have more side effects than you might be looking for. If you're experiencing any of these uncomfortable symptoms of the transition to menopause, but you're a little concerned about going on antidepressants, or you don't want to do something that feels as extreme as hormone replacement therapy, we have a lot of naturopathic options that can make the transition more comfortable and more gentle as you transition into this normal state of menopause. From a naturopathic perspective, we really look at supporting the hypothalamic, pituitary, adrenal axis in a different way. A lot of what we do helps support the adrenals and regulate that there, and also regulates the hypothalamus, and in turn can reduce hot flashes, night sweats, and irritability and some of the discomfort as you're going through the transition to menopause without the side effects. So there are a lot of herbs, teas, and supplements that you can take to really get a handle on hot flashes and night sweats and irritability and mood swings that don't have the side effects associated with antidepressants, and are things that you can quit cold turkey. You don't have to wean off of them. There isn't a big long backlash of side effects or withdrawal symptoms coming off of the herbs. We also, as a naturopath, have other tools in the toolbox, including bioidentical hormones that can be used topically or can be used internally in different ways and at lower doses, and in ways that mitigate possible risks of cancer or other side effects that might be associated with more commercially manufactured hormones. If you want to know more, I recommend setting up an appointment for a naturopathic consultation, and we'll be happy to answer all your questions. If you have something quick we can answer now, just drop it in the comment box, and more on menopause later this week.